Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com, meaning of the medical abbreviations CT and Q6H. CT and Q6H are both medical abbreviations used on prescription medications. CT medications should be taken 4 times a day, while Q6H should be taken every 6 hours. While this may seem redundant, it's not. There's a key difference. /R/N/R/N with CT medications, you need to space out your doses, but not by a specific number of hours. You can take your last dose before going to bed instead of waking up at night to take it. /R/N/R/N medications labeled Q6H need to be taken following a specific schedule. You may need to wake up at night to take a dosage to make sure you're spacing each dose 6 hours apart. /R/N/R/N This article explains the medical abbreviations CT and Q6H and covers other common medical terms used to describe how and when to take your medicine. /R/N/R/N The medical abbreviation CT means 4 times a day. It may be written as CT, CT, or QID. It is Latin for quaterindi, which translates to 4 times per day. /R/N/R/N You only need to take CT medication when you're awake. Your prescription may come with the note CT while awake or something similar to clarify that this is the case. /R/N/R/N The following times of day are optimal for taking CT medication, and the time between doses doesn't have to be exact. /R/N/R/N whether written as Q6H, Q6H, or Q.6h. This medical abbreviation stands for the Latin phrase Q6h, or every 6 hours. Q6H medications are categorized as around-the-clock, ATC, medications. ATC medications need to be taken at set intervals so the drug levels in your blood stay consistent and high enough. /R/N/R/N ATC medications include drugs for heart disease and high blood pressure as well as blood thinners, drugs that keep your blood from clotting. Severe pain is also often managed with ATC dosing. Pain tends to come back quickly once the dose wears off. Taking the right dose at set intervals may help keep your pain from spiking. /R/N/R/N If your prescription says Q6H, you can take your doses at the following times or at any other time of day as long as you keep a 6-hour regimen. /R/N/R/N You may see these abbreviations on your prescription, and your pharmacy should give you written instructions explaining them. /R/N/R/N Some abbreviations, like QD, once a day, QOD, every other day, and others, can be easily confused with one another and are no longer used. These terms must be written out because they can contribute to medication errors. /R/N/R/N medication errors can and do happen. They often cause side effects, which may require an emergency room visit or hospitalization. Some errors lead to death, including those involving opioid medications. It's estimated that half of these errors are preventable. /R/N/R/N help prevent medication errors by being your own advocate. /R/N/R/N Healthcare providers often use shorthand terms when prescribing a drug. They may use abbreviations on prescriptions, such as CT and Q6H. These and other forms of medical shorthand are well known in the healthcare setting. But using them is by no means a required practice. /R/N/R/N Be sure your provider or pharmacist clearly explains how and when to take your medicine. Ask them to clarify what you do not understand or would like to know about this drug. This can help prevent medication errors. /R/N/R/N/R/N/R/N Thank you. Form.email, for signing up. /R/N/R/N There was an error. Please try again. /R/N/R/N RxCardClub.com. Get a free prescription drug card and save up to 80% on prescription drugs.